Hi everybody, it's just Claire McEwen here from True Potential Hypnotherapy. I wanted to do this quick video today because I know there's a lot of concern out there for this whole coronavirus. I know how worried and anxious a lot of people are feeling, and I recognise that those feelings, those anxiety can be escalated tremendously, and that people are worried for themselves and their families. So I personally have seen a huge increase in the amount of people I'm seeing, and obviously I'm listening to this all the time, so I know exactly how they're feeling. So I thought this might be a good idea for me to put a quick video together. So what I'm going to do is, I've done my research and I'm going to give you a few guidelines that may help, but I also just want to quickly give you an overview. As a lot of you will already know, I am an expert at helping clients with anxiety. I help with all types of anxiety, and it is the thing that I'm the most passionate about. I mean, helping somebody in that way is so brilliant. And I just love helping people. But this whole coronavirus has added a new layer onto their anxiety and their fears. So I want to help as many of you as I can to feel a little bit calmer, so that you can take some control of you and the situation. And sometimes the way to do that is to have a little bit more knowledge. And I want you to know that the things that I share in this video, I have done my research, have looked at the correct places, which if you're using Google or any other thing, please make sure you go to the right places. I mean, the NHS or the World Health Organization, or look at your local area. Please make sure you go to correct sources. Do not listen to rumours, do not listen to gossip, because there are people out there who just want to scare you. And actually, the stuff that I'm going to give you is what I know for certain at this point. And I want to allow you to take some control. And I want you to feel that you've done everything you can to protect yourselves and your loved ones. So if that's all right, I'm going to just quickly go through the things that I know that you can do to keep yourself safe and to keep those around you safe, the people that you love and care for. So first of all, although I will probably have a little bit of a rant here as well, but first of all, the very first thing that's anywhere you look is wash your hands thoroughly and frequently. So firstly, I'm going to say, at what point did people stop washing their hands? Because I went to Asda the other night after a meeting, and I swear to God, the shelves were empty. There were lots of things, but one of them was the whole hand sanitizer. I think, who needs that much hand sanitizer? And why do you need that? Are you using that instead of washing your hands? Because please do not stop washing your hands. But trust me, they recommend that you wash your hands for at least 20 seconds. Everybody knows how to wash their hands. You know, use regular soap and water. Or, obviously, if you're not anywhere near soap and water, then you can use hand sanitizer. And the reason you do that is by washing your hands with soap and water or using hand sanitizer, you will make sure you're getting rid of any viruses that are on your hands. That's it, okay? So just make sure you wash your hands regularly. But as I say, not sure when that stopped. Please continue with it. The other thing that is recommended is to maintain your distance socially. So if you can keep at least 1 metre or 3 feet, 1 metre, 3 feet between yourself and anyone who is coughing or sneezing, then you are going to be keeping yourself safe and them. So, and the reason for that is when someone coughs or sneezes, they spray liquid droplets from their nose or mouth, which are invisible to the human eye, which may contain a virus. So if you're too close to that person, you can breathe in those droplets. And of course, that's going to be including this coronavirus. Next one, avoid touching your face, specifically your eyes, your nose and your mouth. And the reason for this is that many surfaces that you touch can easily pick up viruses from others. So anything at all. And once you're contaminated, your hands can quickly transfer that stuff to your eyes, nose or mouth. And from there, the virus can enter your body. So that's, and obviously I don't want you to get sick, so that's what you need to do. The other thing that I need you to do is practice respiratory hygiene. So this means covering your mouth and nose when you cough with either your bent elbow if you haven't got a tissue handy, but obviously a tissue if you can, and then carefully disposing of your tissues immediately. And why do we do this? Because those droplets spread virus. And so to protect the people around you, we want to get rid of them safely. The other things that are recommended, if you have any signs of the coronavirus, so I don't know, even mild symptoms like a headache, slight runny nose, coughing, continuous coughing, and obviously fever, then they recommend that you avoid any contact with others, and don't even visit medical centres, but look after yourself. And they say to recommend this for at least 7 days. And if you can do that, you will help to stop the spread of the virus. And the other thing to know, but if you do develop a fever, if you have a continuous cough and you have difficulty breathing, you do need to seek medical advice. Now, here in the UK, that is, you need to go online to www.111.nhs.uk or call 111 and speak to somebody there to get the advice that they need, and that you need to know what to do next. If you decide to just go to somebody, which I don't recommend, please call them first, because there may be a few questions they need to ask, and they will also make them determine where they send you. So, please think about everybody else within this, and you will keep yourself safe as well. So those are the recommended tips. A couple of tips that I've got for you as well. I want you to know it is quite natural to feel a little bit sad or down or low or confused, scared or angry when there's some kind of crisis. And this is classed as a crisis, even though I don't feel that way. I'm just at home doing what I always do. But it does help if you're feeling that way. Make sure you talk to people you trust, and stay in contact with your friends and family. Make sure you have a plan. So make sure you've got the numbers written down or what to do should it be that you need to do them. So then that means you've got a bit of a time. Limit the time. And this is really important, and it's something I make sure I tell people all the time. Limit the time you spend watching or listening to the media. So that means your news channels. There's a lot of scaremongering out there, and sometimes the way in which they record it makes you feel much more worse and much more anxious. So please limit the amount of time that you spend listening to that. Just go to the correct sources. If you must stay at home, make sure you stay healthy, including a good diet. Make sure you get plenty of sleep, a little bit of exercise, and stay in touch with your loved ones. That's the best advice I can give you. Make sure the facts that you get are clear and they're accurate, and that you've got them from the right places, which is the World Health Organization or the NHS, or check your local area to see if there's anything specifically going on there. And the other thing I want to say is you've got all the skills you need, because however old you are, you've got that amount of years of skills to know that you can come through most things. So all I want to say to you is draw on those skills from the past that have helped you get through life's challenges and use them now to deal with this. And most of all, I want you all to stay safe, look after yourself, and you know what? Use common sense. Look after yourself, eat well, sleep well. You will be absolutely fine. And I'm going to go for now because my phone's ringing and I need to answer it. I'll speak to you all soon. Bye for now. Have a great day.